Yes.
So first and foremost thing that we need to look at when we want to make a maxillary impression is the position of the patient, the way the patient is seated. So the patient should always be seated as upright as possible. Basically, we don't want any material to get into his throat. So we don't want to shove the material posteriorly. So any reclination or reclining of the backrest of the dental chair would result in the material being forced more towards the palate rather than anteriorly. So we would like to keep the patient as upright as possible. So keep the backrest as straight as possible. So that is as far as the patient position is concerned, and where should the operator or the dentist stand when you make a maxillary impression. It goes without doubt that the dentist has to stand in a position which is the most comfortable position to make a maxillary impression, and that would be right there. Okay? So, or if you use the clock as a positioning device, we can say it's an 11 o'clock position. That means you are somewhere behind the patient, slightly to the right. So that would be the ideal position where you would be able to use both hands to reflect the cheeks as well as load the tray in the patient's mouth. So first and foremost, before making the impression, we will want to examine the mouth, open wide, and look for all the structures that are important for us, just to see whether there are any prominent frenum, any soft tissue thing, anything in the palate like tori or something, and of course whether we can reach out to the hameral notch. Now, whenever you select an impression tray for a maxillary arch, the most important thing is to select the tray for extension. So what extension are we looking at? The extension that we are looking at is posteriorly. It's the hameral notch. Irrespective of whether you make an impression for an RPD, irrespective whether you make an impression for an FPD or for a complete denture, our aim is to select a tray which covers the hameral notch. That is the posterior landmark that we are looking at. Every time we need to make sure that our tray extends till the hameral notch. And also what we need to do is the lateral extension of the tray. We should be making sure that we are able to record the sulcus, and at the same time, for an alginate impression, we would require a minimum of 3 millimeters of recording space for the alginate to do its job. That means you need to have a space of 3 millimeters between the tray flanges or the tray borders and the tissues or the teeth, so that you don't have any exposed areas in the impression. So that's what we are looking at. So getting into the trays that we are looking at. So as when we talk about the trays, we all are aware that we have different types of impression trays. We have perforated trays, we have non-perforated trays, we have dentulous trays, we have edentulous trays, we have plastic trays, we have metallic trays. So we have different types of trays. So when you talk about the dentulous trays, this is how the dentulous tray look like. Ideally, everybody should end up using trays what we call as the rim locked trays. They are beautifully designed and their borders are not sharp, so you can make good impressions with that, and also at the same time it is more comfortable to the patient to do. What only thing is they are slightly on the more expensive side, but when you have to make anything a good prosthesis or a good impression, or you want to be a good dentist, most important thing is you should always invest on equipments that you're using, and that would be the impression trays. So in case you're not investing on them, then of course these are the regular trays which come very cheap, and as you can see, the edges are very sharp and they don't have any contours like how the contour of the sulcus would be. They are all at one level. They don't have contours like this. So they are quite sharp, so they are uncomfortable and may not be fitting the oral cavity well. So these trays you need to adjust quite a lot for extension, as well as you need to create things on add certain material on the borders to make them less pokey to the patient, or less painful for the patient and more comfortable for the patient. So when you pick up a tray to do a tray selection, as I told you, posteriorly the tray has to extend right up to the hameral notch. At the same time, you should understand that the mouth opening is something which you should look at. This patient has got a quite good mouth opening, so you should be able to shove in the largest tray here. But we would like to select a tray which is according to the arch. The arch form is quite medium. So we will first pick up the second size tray and check whether the extension is good enough. So every time you want to insert the tray into a patient's mouth, first thing you need to do is you have to take your left hand around. I'm talking about a right-handed dentist now. Everything will change if you're a left-handed dentist. So the right-handed dentist, the left arm goes around and you reflect the cheeks on the left hand side with the index finger or maybe a couple of fingers if you want. And then the tray goes in a nice rotation like this. You cannot try to push the tray like this straight into the mouth. It's so difficult to do that. So you should always try and rotate the tray into position. So this is how we take the tray into the oral cavity. So once you take the oral tray into the oral cavity, the next important thing that you want to do is to center the tray. The tray has to be in the center of the face and of course the center of the arch. As far as what we are expecting is most of the times, unless your patient has got gross asymmetry, the arches are also in coordination with the center of the face. So once it is centered, then you slowly try to place the tray loose, lips loose, don't try to pull. Slowly try to place the tray in and set. So when you place the tray, you can't go too close so that the teeth are touching the borders of the tray, nor can you go so far away so that you have too much of bulk of the material in the anterior aspect. So as I told you, we are looking at 3 millimeters. So around 3 millimeters, and then slowly place the tray. Then drop the lips. So once you drop the lips, you can see that so the borders are good, nowhere it's impinging. So now we need to see whether the tray is extending up to the hammer notch. So you can always use a mouth mirror to check whether the tray is extending up to the hammer notch. So a mouth mirror will clearly show us whether it is, and you can see there, you can see the tray extending up to the hammer notch here on this side, and of course it should be the same on the other side. So this would be an ideal tray to make a maxillary impression on this patient. So you can see that it is easy to insert, goes in nicely, comfortable, size is comfortable as far as insertion is concerned, and of course we have seen that the extension is good. Nicely you can rotate the tray into position, center it, and then place it in the mouth. So this is something you need to do irrespective of how experienced an operator you are, and definitely as students you need to do this repeatedly before loading this tray with alginate, that is placing the tray into the patient's mouth. Again I tell you, this left hand goes around the patient, corner of the mouth, rotate the tray into position, position the tray, center the tray, position the tray anterior posteriorly so that there are 3 millimeters space between the labial surface, and then slowly place the tray. And then you need to record the sulcus, so you need to drop the lips over the tray border, and maybe you can slightly mold the cheeks. So this, without loading the alginate, you need to do at least 4-5 times or even sometimes more for you to get accustomed to what you're doing, so that once you load the alginate on the tray, you are more comfortable doing this. And also the patient is aware what you're going to do with the tray. So it's not that you just load some alginate and take it and the patient is suddenly moving away saying what the hell are you doing. So that would become very disastrous for you, because you know the alginate doesn't allow that kind of a time. So the patient now knows when you repeatedly do it, okay, this is what the dentist is doing, so it's not taken by surprise when you're actually going to make the impression. So this tray doesn't require any alteration. As I told you, straight away we can go ahead and make the impressions. So whereas when we want to use these trays, these cheaper trays, so this is where, so you can see that this tray looks quite big for his arch, so we may have to try and use this, but at the same time I don't think this tray would be extending right up to the hamular notch. So again we rotate the tray into position, center the tray, open the mouth, center the tray into position. Now we will use the mouth mirror to check if it is extending up to the hamular notch. As you can see, it's not extending up to the, in fact it is not even covering the last molar. So that's how badly designed these trays are. Okay, it's not extending, not even covering the last molar. So this extension is not enough. So if the extension is not enough, so we would think that the tray is smaller. So we try to select something bigger. So something bigger, of course it will enter. It's got a wide opening, but you can see there is this area of focus, this area of focus. There is too much of space. We're not looking at 3 millimeters. Here we're looking at almost 8-9 millimeters of space between the tray border and the tissues. That is what I'm talking about, is the gingiva or the masticatory mucosa. So what happens then is the tray border is actually impinging onto the cheeks rather than going into the sulcus like this. Impinging into the cheeks rather than going into the sulcus like this. So this tray is too large laterally, maybe covering the hamular notch anteroposteriorly. So we need to be sure of the tray extension laterally as well as, okay, here it is extending quite okay towards the hamular notch, but laterally it's too big, so this is not the tray for us. So this would be a tray for us. So if you want to use this tray for making impression, that means we need to make this tray sizable enough so that you can record the entire maxillary arch right up to the hamular notch or cover the hamular notch. So if you want to do that, we need to extend the posterior border of the tray. So when you want to extend the hot water,